Hello, you're watching EASDtv, and I'm delighted to welcome into our studio Partha Kar from the UK. And we wanted to talk to Partha because the UK has become one of the first system in the world to have the widest access to CGM and also now artificial pancreas. And what I wanted to find out was how he did it, not quietly.
So I think there's a combination of factors. I would say, first of all, thank you for the kind words. And it's a team. And I don't say that lightly. It's not a glib statement. We have had a fantastic team around us, a team which does the data, a team which does the tracking. But a lot of it has been about challenging clinicians, about their views, changing systems, and also chasing down every single area which was not implementing it. So it's been a long journey. It's taken us a good 6-7 years to get here. But it's been a fun journey, I would say. So, and here we are, and that's been completed. The continuous glucose monitors, we've got pretty much universal access, and now we're into the next phase of the hybrid closed loops or the artificial pancreas, as they're dubbed. So exciting times, I would say.
So what's the first step for those people in countries where this hasn't been achieved? What's the first step? Because everybody immediately say it's all about money and it's about resources.
The actual answer is it's not, right? Money is absolutely important. I think there are some fundamental things that people miss in lots of places. I think they look at technology, and I think there's a degree of inertia from a lot of clinicians about adapting new things, a bit of insecurity about what it would do to their jobs. So you have a combination of those things. So if there's one thing you do, I think it's understanding of clinicians are not a homogeneous mass. There are people who are with you straight on day one. There are people who need more convincing. There are people who will join because everybody else is. And finally, there'll be the skeptics.
So the diehards who really don't want to be... And it's partly about a thing about autonomy, isn't it? They don't want to be pushed because they want to make the decisions.
Yeah, to an extent, I think it's also because of the way the system works. I think we talk a lot about patients being in charge. I mean, the reality is it's not. So I think once you move the control, so to speak, away from the clinicians, and that has been a fundamental part of the journey, the support and the power of the population with type 1 diabetes has driven a lot of clinicians to change. And I think that's a fundamental factor because doctors will listen to their patients when they're going, come on, it's standard care. Why am I not getting this? So I would say that's a big factor for all countries to adapt. Listen to those whose lives you're trying to change. Don't try and do it in a room.
So that's the first tip, is make it a patient-driven change.
Absolutely. It's self-management at its cutting edge, right?
And the other thing clinicians forget at that peril is actually they only see people living with diabetes a few hours a year. But actually the patient lives with that condition for the rest of the time, and they are really expert in their condition.
So I've got a saying that any chronic disease sits on 3 planks, which is self-management, peer support, and access to trained professional. And every health system keeps on doing the same thing, which is, let's get more trained professionals. The problem with that plan is we don't have enough trained professionals. So, and as you said, they will actually have 0.01% of their life with the professional. So anything you do to make self-management better and get them to talk to each other will improve their lives. And that's what you're seeing with continuous glucose monitors.
Okay, let's have another tip from you because, as you said, there are the people who are on board straight away. There are the people who will join. But how do you start to get those reluctant people on board?
I think I go back again to, at the end of the day, the majority of people are doing it for the right reason. And I think this is where it should not be seen as, here is a national body person telling me what I should change.
That's a really important point.
And it's really, really important not to go and sort of, walk around with a big stick saying you must change. But those individuals, 9 out of 10 will respond to the person with type 1 diabetes sitting there going, look, everybody's getting it. And this is standard care. How can you help me get it? And I go back again, is that that's the key. If you can get the people with type 1 diabetes or any chronic disease into the portfolio of talking, you will have pretty much everybody on play.
What about getting policymakers on board?
Well, as a policymaker myself, I think...
just tell people why you're a policymaker, because you're a clinical lead, but what does that mean for those who don't know the NHS?
Yeah, so I think my role is to look at type 1 diabetes and improve outcomes. That's it. And I think when I took over in 2016, 17, outcomes were really poor. Access to technology was about 1%, 2%. And I've always said that how can we make self-management better? How can we make peer support better, which has driven a lot of the work? So policymakers, at the end of the day, need to understand what are they trying to change? How do you actually improve outcomes? And if the philosophy is, forget about getting more professionals, what can I do to make your quality of life better? Chronic disease will improve, always does. So I would rather we put more support into primary care, mental health, all those things. If you did it better, chronic disease gets better. So that's the key.
And the policymakers take that on board?
I think not everybody does. I think it depends as to what you feel you're trying to achieve. I think a lot of people are very concerned about the money. And you go around in a circular debate about, yes, we should invest to save, but we have no money to invest.
Yeah, it's that upfront clash that's often the problem, isn't it?
I think this is where I think policymakers have a role, and they should have a skill set in negotiating with politicians, i.e. the ones who will hold the purse strings in the case of public funded system, explain to them. And at the end of the day, my experience of working with politicians has been overall good. They have all funded it, but you have to make the case with data. So that's the other big point. Collect your data to show what you're achieving to get more of your politicians on board with the funding.
And involve them. I mean, you need to take them on the journey so that, yes, they've agreed it, but you need to keep involving them all the way along the journey so that they can feel good about something that they've done.
So, and I think you're absolutely nailed it. Politicians are human beings. They also want to see what they've achieved. So our progress onto artificial pancreas has happened on the back of the success of the continuous glucose monitors, because we've been able to see look what you did. Why can't we do the next stage? And I think they also see a good news story. It's not very common for the NHS to come up with a good news story. So I think everybody in the health sector gets really happy and they say, right, let's do the next thing. So I think success does breed success from that point of view.
Another learning point for people listening, what would you say?
I think, and again, it comes out as sometimes glib and a very sort of blasé statement, but I do think people forget who they're serving. And I really do mean that, is that I spend a lot of time interacting with those living with type 1 diabetes. And the love and support I get back in return is simply phenomenal, right?
How many people follow you on social media?
It's about 55,000 on Twitter and another whatever numbers on Facebook.
There's a lot of interaction with Twitter. Follow Partha on Twitter.
But I like that interaction. I want to hear what they're not getting. And I think if you then step in and help, they will support you with everything they have. And I think to policymakers and to systems, I would say is that today I've had to spend a lot of time in this conference and people have said, what's the next big thing? And my answer is always very simple. You're asking the wrong person. Ask the person with type 1 diabetes, which part of their life you're going to make better. That's your innovation. Whatever it is your next big step.
And it may not be the same as clinicians think is the...
It will absolutely not be the same. Yes. I can tell you it will not be the same. If it was, very rarely it matches enough for them to everybody align. But that's why you got resistance to change, because clinicians thinking, maybe that's not what I need better education. While lots of patients, no, I just want to look after my diabetes day in, day out better. So I think listening is key to that sort of part of the journey.
Final thoughts on this. It's taken, 7 years?
Yep.
It's taken 7 years. Your next challenge is artificial pancreas. After that?
So I'm looking at, I'm a big believer in, I would like to help in other countries, which is what I'm doing right now, talking around the globe, South Africa, India, all that. But I do want to have the patient voice much louder in the NHS. That's been a big passion of mine. And I think one of the other things that I would like to look into is better representation. And I don't say that lightly. I mean, I've been doing sessions here in the EASD where there seems to be a lack of women. And I've asked that question, is it because we're not trying? Is it because we haven't given the opportunity? And the reason I say that is not because of some political correctness. It's because of one of the things we discuss right now and we're talking about is women who are trying for pregnancy should have access to technology first. And the queries I get is simply based on a complete misunderstanding or a lack of understanding what pregnancy involves by a group of men. So I think it's examples like that, having people more diverse in that setting, I think is incredibly important to change policy and take it forward. And I'd like to do that and more in the future.
Partha, it's been an absolute joy talking to you. Such insightful words there. And you can get this interview again and look at it again and again and take down the thoughts on EASDtv. Bye for now.